When you visit a hospital, you probably think they get paid for the care they provide, for the time a doctor spends with you, for the skill of a nurse, for the effort of your treatment. But in most cases, that's not what's happening. Hospitals don't get paid for care, they get paid for categories of care. First, it's important to understand that diagnosis codes are not the same as your lived experience. When you're treated, everything that happens to you, every test, every procedure, every consultation, is translated into a set of standardized billing codes. A complex human experience, like recovering from pneumonia, is flattened into a category, for example, DRG 193. That code, not your personal story of recovery, is what the hospital sends to the insurance company for payment. This system creates misaligned incentives. Critical parts of healing, like a doctor's time spent coordinating with other specialists, a nurse's effort to educate a patient, or a focus on preventing future illness, are often undervalued or not directly reimbursed. They are considered part of the overhead for the billable event. The system rewards things it can easily count: procedures, tests, prescriptions, not the slow, human work of coordination and prevention. This is why frontline staff often feel so squeezed. They're caught between the patient's needs and the rigid demands of the billing system. They might want to spend more time with you, but the hospital's financial health depends on moving to the next billable event. This pressure leads to burnout for providers and a feeling of being rushed for patients, even as the overall cost of care continues to rise. Ultimately, this creates a fundamental mismatch between the mission of healing and the business of billing. The people providing the care are focused on your outcome. The system that pays for it is focused on the transaction. When you see this, you realize the system isn't broken, it's working exactly as it was designed. It rewards transactions, not outcomes. The frustration you feel as a patient or that a doctor feels as a provider is a direct result of this design. Most people inside the healthcare system, the doctors, the nurses, the administrators, feel this fracture every day. They are trying to bridge the gap between care and commerce. So, if you've ever felt that something is deeply wrong with how healthcare is paid for, you're not imagining it, you're seeing the system clearly.